About 1.3% of the population between the ages of 3 and 85 present salivary lithiasis pathology. They are located primarily in the submandibular gland, but also in parotids and rarely in sublingual glands. We presently use a new electrohydraulic shockwave lithotripter specially developed and adapted to salivary lithiasis. The fragmentation tube is fixed on an articulated arm and has an extremely narrow focus of 2.4 per 25 millimeters. An inflatable balloon allows us to adjust the depth of tissue penetration.
Oui, le calcul. Voilà.
The patient sits in an upright position. The procedure is extremely simple. One starts with perfect positioning, using a manual switch on the tube facing the stone. Stone size has no importance, but its location by ultrasonic control is essential. The intensity is adjusted by a control knob graduated from 1 to 6. To start, intensity 1 must first be selected and can then be increased and adapted to the patient's acceptable pain tolerance while yet remaining efficient for fragmentation. The shooting frequency is around 120 impacts per minute, but if necessary may be reduced to 90 or 60 impacts per minute. During one session, about 2,000 impacts plus or minus 500 are delivered. Fragments of variable sizes are perfectly visible on the ultrasonic control screen. They move cadenced by the shock waves. This electrohydraulic shockwave lithotripsy is a nearly painless treatment due to its important wave focusing, preventing adjacent tissue injury, and anesthetics are not needed. The treatment can be performed on children. The sessions are repeated after a 1-month delay, and antispasmodic and sialagogue treatment are prescribed for 10 days after a lithotripsy session. The indication of this type of extracorporeal shockwave lithotripsy concerns stones located in the proximal part of the Wharton canal or in the gland itself, at the submaxillary level, no matter where the parotid is. This index permits stone size measurement. With an intraglandular infection, extracorporeal shockwave lithotripsy is not performed. An antibiotherapy is then prescribed for at least 5 days before the lithotripsy session. Also, in case of hemostasis trouble, this type of lithotripsy is contraindicated. Stone fragments are eliminated either spontaneously by the gland canal or extracted with an ultra-thin basket probe.